distinguished members of the Psychopharmacologic Drugs Advisory Committee, thank you for your time and attention. My name is Sasha Sisko, and I have no financial relationships to disclose. Today, I will highlight 4 incidents of misconduct that raise significant ethical and legal concerns which merit your urgent consideration. I speak as a survivor of PTSD. I will partially draw upon findings from my preprint entitled Omission of Serious Adverse Events within MAPS-sponsored clinical trial publications. First, MAPS founder and Lykos board director, Richard Doblin, PhD, has described the publicly available footage of the physical sexual assault of a MAPS phase 2 trial subject in the treatment room as depicting a, quote, technique involving, quote, psychodrama that, quote, can be beneficial in the context of psychotherapy. To wit, MAPS has published a book by Stan Grof entitled LSD Psychotherapy, which endorses, quote, sometimes inflicting pain, end quote, upon patients during, quote, intense psychodynamic struggles. Second, Dr. Doblin has proposed enrolling Ukrainians housed at refugee centers into a MAPS-sponsored clinical trial examining MDMA-assisted group psychotherapy in sessions involving upwards of 100 participants. Although Doblin has described such, quote, humanitarian projects as, quote, a risk that MAPS must take, his stated proposals violates the Nuremberg Code. Third, I have documented dozens of instances of Dr. Doblin promoting off-label use of MDMA-assisted couples therapy and, furthermore, encouraging the general population to practice MDMA psychotherapy as detailed in the MAPS treatment manual. Despite contacting the FDA and MAPS representatives about this, I have not, to my awareness, received a response to these matters. Fourth, I have reported on footage depicting a MAPS trial subject informing multiple MAPS researchers that they engaged in suicidal behavior during their clinical trial after their first MDMA treatment session. However, the relevant trial publication claims that no suicidal behavior occurred, quote, during the treatment period after dosing. I can provide this footage to the FDA upon request. It should be noted that Dr. Doblin famously criticized another psychedelic researcher for omitting a serious adverse event from their publications, stating that, quote, there is no justification for this omission, no matter how unfairly the critics of this research may have used this information, and no matter how minimal the negative persisting effects reported by the subject. In conclusion, I urge the FDA and its Office of Criminal Investigations to thoroughly investigate these substantiated allegations to ensure compliance with federal laws and FDA regulations while safeguarding the public's safety as well as the safety of patients. Thank you for your attention. I yield my time.